Hi, my name is Haley, and I was in the section that talked covering nutrition and eating behavior. The first article that I read was a cross-sectional analysis that compared two different groups of nutrition students, those that were in their first or second semester and those in their seventh or higher semester. And they also had control groups from other study programs. Um, they assessed the dietary restraint, disinhibition, t tendencies toward orthorexia nervosa, healthy food choices, using a structured questionnaire. Some of the key findings that they found in the dietary restraint section were that nutrition students exhibited a higher level of dietary restraint compared to the control students. The restraint was categorized by both rigid and flexible control, which indicated there was a conscious effort to manage food intake. Initial The key findings from the orthorexia nervosa was that the initial orthorexia tendencies were similar between nutrition students and controls. However, these tendencies decreased among the more advanced nutrition students, which suggested that an increased nutritional knowledge may reduce obsessive healthy eating behaviors. The key factors from the disinhibition section was that there was no significant differences in the scores between nutrition students and controls, which indicated that there were similar tendencies towards overeating in response to external cues. The key findings from the healthy food choices was that advanced nutrition students made healthier food choices compared to their peers in other studies, and it showed a slight decline in healthy eating behaviors over time. The study showed that nutrition students may have a greater tendency to restrict food intake to control their weight, but they do not exhibit more disordered eating patterns than students in other fields. As their studies progressed, nutrition students adopted healthier eating behaviors in order to reduce obsessive tendencies related towards food. These findings from this study suggested that comprehensive nutrition education does not necessarily lead to disordered eating behaviors. Instead, it may promote healthier food choices. The next article I looked at was talked about the relationship between adolescents' nutrition knowledge and their eating behaviors. It involved 532 middle school students. It aimed to examine whether nutrition knowledge correlated between healthy eating behaviors among male and female adolescents, and it's attempted to assess whether the grade level influenced this relationship. Some of the key findings were that there were gender differences, which showed that females generally had a higher nutrition knowledge score, especially in grades 7th to 8th. It aligned with their other literature suggesting that adolescent girls may be more receptive to health education and more body conscious, which can drive knowledge acquisition. It also talked about how 7th and 8th grades, a significant positive correlation was observed between nutrition knowledge and healthy food choices. There is no correlation found among the sixth graders, possibly because of cognitive development stages, where the younger students might lack the critical thinking skills they need to apply abstract knowledge to real life choices. It also talked about how there was the overall nutrition knowledge was low, which indicated that students didn't had a low and limited understanding of nutrient functions, dietary guidelines, and food label usage. They reported that students did not use the food pyramid or similar tools when it came to choosing foods. The next article was talked about uh, diet quality, sustainable nutrition, and eating behaviors among university students, and looked into investigating the impact of nutrition education on dietary habits, as well as sustainability awareness among university students. They found that approximately 44.8% of students in the nutrition and dietetics field, uh, as well as 56.4% in other programs, had a good diet quality based on their MAR levels. There is no significant difference between these two groups. They also looked at the eating behaviors of those in the nutrition and dietetics program, and they found that they scored higher on the healthy and balanced nutrition factor of eating behavior scale, and the females specifically scored significantly higher on scores uh, from the seasonal food and low fat factors compared to their peers in other programs. Thank you for watching.